When you go to see your doctor about any complaint, make sure you let your healthcare provider know exactly why you're there. Be very clear. Hi, doc, I'm here today to talk about X, Y, or Z. Hey, doc, I made this appointment because I've been having this symptom. Hey, doc, I wanted to come back to follow up with this thing we talked about before. And say that before your doctor gets into reviewing labs and old stuff and you guys start talking about the weather or whatever you do. I say this because it will help set the tone of the office visit. It will help give your office visit direction. It will also help keep your doctor on task and help them know, okay, this is what we need to figure out today. It will also help ensure that you don't run out of time. If you mention these things at the end of the visit, you might just run out of time, or there may not be enough time, and your concern may be pushed back. So bring that concern up at the beginning of the visit. The next thing is making sure that you have a list of questions in hand. Make sure you got that list of questions. Why? Because often when we get to our doctor's office visit, we forget the things we wanted to ask them. If you have a list of questions and your doctor sees you writing down answers and going through your list, it will also consciously and subconsciously let your doctor know, hey, there's a task that we need to accomplish. There are more items. And literally, I love it when I see patients' lists because I'm like, oh, what's next on your list? It helps keep us on track. It helps us accomplish our goal. And the next thing I would say, the third thing is make sure you keep a detailed log of your symptoms, okay? It is much, I think, my gut feeling is much harder for physicians, healthcare providers to dismiss or ignore symptoms when somebody is very specific and very clear. Okay. Now, we should never ignore symptoms. We should never avoid them or ignore them, even if they're vague. Okay. I'm not saying that our ability to take care of you should be dependent on you. No, it's our job. We should always be doing the right thing, whether you're vague or not. But if you can help it, being specific is really helpful. It's going to be helpful for you. It's also going to be helpful for that doctor to know exactly what you're going through, how long it's been going on, when it started, when it stopped, why you're concerned, etc. Details can sometimes matter a lot. Medical gaslighting is when your healthcare provider inappropriately dismisses or minimizes your health concerns. This can happen for a variety of reasons. Sometimes healthcare providers minimize health concerns or deem them purely psychological when they are not. It's another way of sort of gaslighting, shall we say. It is never okay, and you don't deserve that, and that's why I'm doing this video. I had a patient once tell me that they didn't realize that they could kind of interrupt their doctor if they needed to ask questions or get clarification. Let me tell you right now, it is your right, your prerogative, and we need you to ask questions in real time when those questions come up. Don't ever feel like you have to sit through the whole office visit before you ask a question. By the way, that's probably the worst time or the hardest time to ask a question because it's the end of the visit and we may not have a lot of time left, okay? But the other thing is you have the right and deserve the opportunity to stop your doctor and say, okay, excuse me, 1 second, Dr. Such and Such. Now you said this, but I thought it was this, or but didn't we da-da-da-da-da? Or, well, wait, I thought you thought it was this thing. Or, so now you think that blah, 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 blah. You have every right to do that. And it's not about being confrontational. It's about actually having a meaningful dialogue with your doctor about your body, your mind, your health, which you deserve and which is your right. So ask questions as your doctor is talking. If they're going on about putting you on a medication, you say, well wait, is it da-da-da-da-da? Ask right then and there. It's okay. All right. Next thing you can do, and what I actually think is very important, especially if you feel like you're being gaslit by your healthcare provider or have been in the past, bring an advocate, a buddy, a friend, a partner, a spouse, a brother, a sister, a parent. Bring someone with you, a friend, a neighbor. Bring someone with you to the office visit. That is right. And not only that, not only just bring them and have them sit, allow them or encourage them to chime in when they feel like they need to. Chances are they know your situation, know what your frustrations are, know what you've been going through. And sometimes in the heat of the moment, when we as patients are sitting there with a doctor who may be acting all sort of helter-skelter, and we're like, sometimes our friend, our ally can step in and say, okay, doc, what she's wondering is this, or what she has been feeling is this, or what we didn't understand was that. Okay? Bring that buddy with you. Not just to be present, but also to be an advocate, okay? And the other thing is, if you can't bring someone in with you in person, put that person on speakerphone. That is right, child. You get that phone and you say, Doc, do you mind if I call my mom or my sister-in-law? Just want to have her part of the visit. Put them on speaker. And I do this all the time with my patients where I'm talking to spouses or whatever to explain things I need the family or other people to know. So do not hesitate to do that. Sometimes actually just having another person in the room, whether it's virtually or not, is all that is needed to kind of change the dynamic of medical gaslighting that we may sometimes feel. Another thing is understand the next steps. I think one thing, and I've realized this with my own patients, sometimes I may not be entirely clear about what I want my patient to do next. No, I am clear myself as a physician, but what I mean is sometimes I realize by what my patients say back to me that I may not have been clear with my patient about what I want them to do, meaning it's all in my head, but I haven't fully or completely or maybe explained it well enough to my patient, okay? We doctors, we pretty much always have some sort of plan, but we have to communicate that, and sometimes we don't do a great job. So if you don't feel like you know what happens next, say, oh, okay, wait. So, okay, am I supposed to get my labs done next? Or wait, do you want me to come back and see you? Or do I see the specialist first? When should I get the x-rays? Ask these questions so you know literally bam, 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 what needs to happen. This will also help hold your doctor accountable for a plan. See, part of medical gaslighting is that symptoms are dismissed. Your symptoms may be dismissed and disregarded. Now, at the end of the conversation, if you're asking your doctor after you've gone through things, okay, so what is our plan to address this? That is putting and holding their feet to the fire. What you gonna do about it, doc? And I mean that sincerely. And that's essentially, that's a really important thing to ask is, what are we doing about this? So what's going to happen next? Ask that question so that you leave knowing exactly what is going to happen next, okay? 3 more suggestions for you. Listen to your mind and your body. Listen to it. I always feel like your gut never lies. Your sort of that inside voice never lies. You listen to yourself. And if something doesn't feel right, you pay perfect attention to it. I have a couple of videos on in the medical gaslighting video that I'm going to link here at the end and through video cards. By the way, if you're watching on Facebook, please let me know. I'll DM these. I have some stories about patients who literally saved their own lives because they refused to allow a doctor gaslight them. Okay? It's a shame that this even has to happen. But it tells you also how much power you have. So you listen to yourself. You listen to your body and your mind. Last 2 things is don't ever fear or be afraid of getting a second opinion. Even if you have a family doctor. I actually had a woman come to me. She was seeing another PCP, but she made a new patient appointment with me because she wanted to know what another PCP would think of X, Y, or Z. You have that right to do that. Get a second opinion from a specialist. Get a second opinion, okay? Get a second opinion. And if your doctor is offended by that, find another doctor. I have a video on second opinions too. Your doctor should not be offended by you getting a second opinion. The last thing is, if all of this fails and your other attempts and efforts, fire your doctor and find someone new because you deserve the best. You deserve to be heard. You deserve to be listened to. I should also say, and I didn't have this in my list, is make sure, don't hesitate to follow up. Ask questions, send a portal message, place a phone call to the office, ask questions. If things aren't getting better, your symptoms are not improving, go back to the office and follow up. Be persistent. This is your body, your mind, your health, and you deserve the best. If you don't get relief with all of these things, then you find someone else who can help you. Remember, you have the power and you deserve the best. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on Facebook. Please like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates. I do daily videos on TikTok, Instagram, WhatsApp, etc. Please follow me at drjencaudle.com. Also, sign up for my weekly newsletter at drjencaudle.com. But guys, I'm Dr. Jen. Love y'all.